child here they may have the case like the MI development here, thrombosis, or is the MI development here. Why MI? Because ischemia. Why MI? Because here having ischemia due to closure of this artery. Now, it's the most common cause. Like it's the cause related with the MI. What the age of the child, age of the patient, the age of the child that is less than 4 years. What this patient having MI? It's related with atherosclerosis? No, it's not related with atherosclerosis. It's something different. It's related with coronary artery disease. It's not. It's related with coronary artery disease due to atherosclerosis. It not have correlation with the coronary artery. It's some problem with the coronary artery, but that problem not due to atherosclerosis. Not this problem. The issue here, the coronary artery having vasculitis. The involvement of coronary artery in the Kawasaki disease, the inflammation of the mucosa, skin, the lymphadenopathy, plus vasculitis involve the coronary artery. The strawberry tongue is a typical finding in the Kawasaki disease. So we need here some researchers are saying that it's an autoimmune disease, and sometimes we're having the antibody, the positive in the blood, anti-mitochondrial, anti-endomysial antibody present here. The antibody sometimes present there. It's autoimmune category, and the involvement of the mucus, skin, lymph node and the vessels, just to avoid this thrombus formation because of the vasculitis there. For treatment plan for this Kawasaki disease, we can prep, or aspirin is very important here. Why I'm putting such stress on the aspirin? Because the aspirin, if you use in the child the aspirin used in child are with precaution. Must be the precaution. There must be contraindication there. Why? The reason here. Why you no need to use the aspirin here? The aspirin, because this aspirin can induce in the child case. In the child case, the child having viral infection. Due to this viral infection, if you use aspirin, now the liver has something bad condition here. The liver develop fatty changes. So due to these changes, the liver develop fatty changes. So fatty changes there. So that's why I don't want to use aspirin in the child. But if the child already having the Kawasaki disease, then we don't care about the liver pathology. I must save my heart from the MI, must avoid this thrombus formation inside the coronary artery. Inside the coronary artery, the thrombus formation there. Inside the coronary artery is a thrombus formation there. So we must avoid here the thrombus formation. I need to avoid the thrombus formation. So that's why I must use this aspirin there. So aspirin, we can use aspirin in the child with the Kawasaki disease. We don't care about any viral infection that lead to the fatty liver changes, and the syndrome known as the Ray syndrome. The Ray syndrome, development of the fatty liver changes after having the viral infection. If we use aspirin in the child, okay, that time is no need to doing this precaution. We must give the aspirin to the child because the heart is a vital organ. That's about Kawasaki disease. Okay, now we move on the pen. What's a polyarteritis nodosa? The polyarteritis nodosa, it's a polyarteritis. It means inflammation of lot of arteries. Polyarteritis. The polyarteritis is inflammation of many arteries except lungs. Except lungs. Many artery inflammation except lungs. So no pulmonary features here. Okay, one very typical finding except lung. And second thing, the association with hepatitis B virus, 30% cases. And the third thing, the association, 30% cases associated with hepatitis B. Third thing we have, if you go for ANCA. Why I am putting such stress on ANCA antibody, C ANCA, P ANCA? Because the clinical features of the polyarteritis nodosa much similar to the small vessel vasculitis. Just to differentiate them, make a difference from the small vessel vasculitis, check the ANCA antibody. If the NK antibody is a negative, then I can think about the polyarteritis nodosa. Okay, one feature, lung spare. The main feature here. Okay, go for the histopathology. What the main histopathological finding? We can see it's a vessel involved, the transmural inflammation involved the full length of the vessel, the transmural inflammation. In transmural inflammation, the vessel having necrotizing inflammation. The vessel having necrotizing inflammation there. The necrotizing inflammation is also a typical feature related with the polyarteritis nodosa. The polyarteritis nodosa, having what the patient presentation, the patient having the CNS sign symptom, some present because the involvement of vessel of the CNS, and thus having the skin featured in the dual formation, the muscle ache there, myalgia, the patient having myalgia, having GIT issue, abdominal pain, this person having the renal issue, hematuria, the vessel involved the GIT, vessel involved the kidney, vessel involved the muscle, the vessel involved the skin having the under the skin a bit hemorrhagic changes there, nodosa, nodule formation there, few sinus changes there. So these are the features there. You can see in all these features, I'm not putting here lung because the polyarteritis nodosa, it all lot of artery except lung is exception. The lungs is a exception here. Okay, it's about the polyarteritis nodosa. And the last condition, we already explained too much here, like thrombotic angiitis. The third condition, the medium-sized vasculitis, and this disease, this vasculitis, is also known as Buerger disease, not mixed with this name to the Buerger disease. Why? Because it's a quite similar pronunciation there, so that's why they're not mixed. Okay, they're totally different things. This disease, Buerger disease, is a disease of the kidney. It's also known as IgA nephropathy. And this is a vasculitis case involving vessels of upper limb and vessels of lower limb. The inflammation due to heavy smoking. The smoke chemical start injury inside the vessel. Then thrombus formation there lead to ischemia of the extremities. The extremities are now having the Raynaud phenomena. Sometimes much severe cases, it may be digit start auto amputation. So all about the medium-sized vasculitis. They're quite quick summary here. The first case is the Kawasaki disease, and second one the polyarteritis, and third case is the thrombotic angiitis. Kawasaki a bit autoimmune cases, and polyarteritis nodosa is vasculitis developed in almost 30% cases. The person having the history of hepatitis B, the 30% cases. And thrombotic angiitis is also a young person. They are the heavy smoker, they're having this thrombotic angiitis. It's all about the vasculitis.